Good day, my name is Imelda Williams. With this video, I'm going to introduce you to the mechanisms of injury that will affect the cervical spine and the upper limbs. So please work through this video, as it's important when you interpret images that you also take cognizance of the way that the injury actually occurred. The one resource that I can advise you is the book by McConnell and Nightingale, titled Interpreting Trauma Radiographs. However, you might have other resources that you can use that will have information on the importance of the mechanism of injury when you interpret images. So it's expected that after this video that you will be able to identify general mechanisms of injuries affecting the appendicular skeleton and in particular the upper limbs as well as the cervical spine. Mechanical trauma is related to a number of things. It's related to the total amount of energy, the duration of impact, the surface area, as well as tissue characteristics. Regarding the total amount of energy, the speed at which you travel will inflict more damage than at lower speeds. With the duration of impact, a bullet, for example, travels at a very high velocity but has a shorter duration of impact and results in extensive damage. With the surface area, a larger impact zone, for example, wearing a crash helmet, allows energy to spread outwards within the helmet frame and reduces the impact of injury. Tissue characteristics also plays a role. Some tissues with greater flexibility will withstand impacts better. For example, younger bones are less likely to fracture than older, rigid and brittle bones. So the influence on the mechanism of injury is also assessed by the kinetic energy that passes through the body or possessed by the body. So to compare, we have a man who weighs 100 kilograms. He's traveling at 30 kilometers per hour. And then we have a female with half the mass at 50 kilograms, but also traveling at the same speed. So if we want to calculate the kinetic energy, there's a formula. So it's half times the mass and then the velocity squared. So in the end, if you work it all out, you will see that for the man, the kilojoules is 45,000, and for the female who weighs half in the mass, it's half of that, and it's 22,500. However, if we increase the speed by just 10 kilometers per hour, you will see that that doubles the kinetic energy for the man to 80,000, as well as for the female to 40,000 joules. So the message with that is that the important feature with high energy trauma is velocity. So speed has a doubling effect on the energy, whereas mass, which contributes at the same rate, has a lesser effect. So what happens when there's a collision? There are actually 3 collisions taking place at the same time. There's the impact to the car, but there's also the impact to the occupants and the interior of the car, as well as the internal organs of the occupants. And this will result in soft tissue injuries, and sometimes it might not have an impact, but it could have an impact. The spleen and liver can be damaged first, as they are fixed and they have moving parts as well. And the aorta is similarly fixed in the thoracic cavity and is susceptible to tearing forces. So regarding seatbelts, really does a great service to protecting the body. But if we look at these 2 occupants of the car, here we have the driver, and you can see that the seat belt is going from right to left. So the injuries that can occur would be the right clavicle, the sternum and the spleen, whereas the passenger, the seat belt goes from left to right, So the front passenger would show the opposite, would show injuries to the left clavicle, sternum and liver, whereas lap belts can cause abdominal tearing and spinal dislocatory injuries. So shearing forces have got nothing to do with getting wool from sheep. It's forces that are created when there's impacts, and it has a rotational component. These forces are generated when the organs move to create cavitation. So looking specifically to the cervical spine, the two types of injuries that can occur is hyperflexion and hyperextension injuries. Hyperflexion occurs when there's a sudden stop and the head still keeps on moving, and this can result in compression of the cervical spine and tears to the posterior longitudinal ligaments. With hyperextension follows when there's flexion as the head is snatched back. It compresses the facet joints and stretches the anterior longitudinal ligaments. So any rotational component may cause spiral fractures of the vertebral bodies. With regards to the upper limb, so direct forces can cause direct fractures, for example, forearm fractures or phalanges, whereas a fall on an outstretched hand injury can cause fractures to the humeral head, supracondylar fractures, dislocations to the elbow, also fractures to the forearm and the wrist. So injury patterns can differ. For example, if we look at stabbings, a woman tends to stab downwards and could cause injury to the neck and chest wounds, whereas a man would tend to stab upwards, and for right-handed male people, the damage is to the liver and the lung wounds, whereas with left-handers, the spleen, heart and lung wounds are able to be damaged. And then finally, looking at blast injuries, there are usually 3 injury patterns relating to the victim. Proximity, so the main thing is how close is the patient to the blast injury. So you could have air hitting or debris, or if the patient is very close, then you could have any of the limb injuries that can take place. So the take-home message is: find out about the mechanism of injury of your patient, because that information is essential to enable consistent and accurate identification related to trauma of the cervical spine and upper limbs. Thank you.